Hi, I'm Angie Kopshai, board-certified music therapist and owner of Music Therapy Services of Portland. And today's podcast is going to focus specifically on music therapy with autism. We're going to answer the top 10 most frequently asked questions. So the first question is, what is music therapy? And I really like Dr. Dale Taylor's biomedical definition of music therapy as the enhancement of human capabilities through the planned use of musical influences on brain functioning. Music influences human behavior by affecting the brain and subsequently other bodily structures in ways that are observable, identifiable, measurable, and predictable, thereby providing the necessary foundation for its use in treatment procedures. So I think most of us know that our brains respond to music and that music can feel therapeutic. And in an upcoming podcast, my colleague Don Iwamasa is going to speak specifically to the differentiation between music therapy and therapeutic music. Meanwhile, I'm going to use my own background as an example. I obtained both my bachelor's and master's in piano before returning to Portland to study music therapy. I went to school for 2 more years and wove psychology, anatomy and physiology, statistics, music theory, and 71 credits of specialized music therapy coursework and practicum experience together. Then I embarked upon a 1,040-hour internship that enabled me to fine-tune my assessment skills and set solid goals and objectives specific to each person with whom I worked. Then, finally, after 8 months of internship, I took my boards and declared myself MTBC, Music Therapist Board Certified. And everyone's path is different. Some students go straight into a program from high school and obtain a bachelor's in music therapy, and some become MTBC before pursuing a PhD in a closely related field or even in music therapy itself. Regardless, we are all required to pass proficiencies in piano, guitar, voice, and percussion. And one of the most distinguishing factors between a musician, a music specialist, a music healer, and a music therapist is that music therapists approach each session with specific goals and objectives in mind. Our approach is client-centered, so the goals and objectives are unique to each individual or each group. And then we document progress and actually spend a lot of time on paperwork. And to give you a better idea of this process, I'm going to share Dr. Dale Taylor's 11 steps to treatment planning using a brain-based biomedical music therapy approach. 1. Collect and examine known client diagnostic information. 2. Assess to determine behavior capabilities and limitations. 3. Formulate your working model of client ability and disability. 4. Reformulate your model according to client brain functioning. 5. Determine what therapeutic outcomes would indicate improved functioning in client behavior. 6. Decide what changes in brain functioning would lead to improved client capabilities. 7. Determine what musically elicited behaviors utilize, require, or develop those brain functions. 8. Determine what musical behaviors and interventions involve use of those behaviors. 9. Assess what musical styles, instruments, songs, and participation modes qualify as patient-specific music, or PSM. And this is also referred to as client-preferred music by a lot of music therapists. 10. Design the musical interventions specific to the desired behaviors that develop and activate the particular brain function on which you want to focus. And 11. Implement the planned interventions to stimulate altered neural impulse patterning in the brain to elicit desired behavior outcomes. So, we music therapists have a lot going on in our brains while we are strumming the guitar and singing along and watching our client and responding according to their responses. There is a lot of assessment going on at all times and some very intentional and deliberate actions that we're taking in order to reach our goals. So the second question, why do children with autism respond so strongly to music? So for me, the short answer is that music provides structure. When I sing, "Twinkle, twinkle, little," and look at you expectantly, it's pretty clear that you're supposed to sing "Star," right? Twinkle, twinkle, little, and fill in the blank. So there is Definitely some really solid structure going on, particularly with familiar music. In addition, the musical aspects like rhythm, timbre, harmonic structure, sequencing, and the ability to evoke emotional responses, all of these engage more of the brain than, say, for example, just speaking. The third question is, why is singing so much easier than speaking for my child? And my colleague, Dr. Elizabeth Stegemuller, is going to expand upon this subject in a separate podcast. So for now, I'm going to say that there is less noise in singing than in speaking. The fourth question, what does a music therapy session look like? How long do they last and how often? I'm guessing that every music therapist has a slightly different approach, so I'm going to use myself as an example here again. I really like to have an initial assessment with a client so that I can observe their response to music, see how they react to particular instruments and songs, and estimate how long they might last in a one-to-one session. Most of my sessions are either 25 or 50 minutes long, so that I have time to debrief with the family or caretaker and complete documentation on the session. How often I see a client depends, and honestly, if I had my way, I'd see them for shorter amounts of time, 4 to 5 days a week. But I really like to see a client at least once a week and can usually see even greater improvement when I see them twice a week. Within a session, I almost always incorporate an initial greeting song. If I'm with a child, I sing a hello song and allow her to play the guitar, clap her hands, and wave at me. And for me, this feels similar to the beginning of a talk therapy session when the therapist says something like, "So, how are you today?" And although I'm not actually asking with those words, I'm watching how my client is responding to my singing, if she's looking at me, how she is playing the guitar, does she clap in time to the song? And I'm using all this information to gauge the intensity of the rest of my session. My other musical interventions are going to vary according to the strengths and challenges of my client, but we generally have a drumming song, a movement song or two, a song that addresses sensory challenges, some sort of brain dance song, some structured time at the piano along with improvisational time at the piano, more movement, singing to a book we do a lot of times, writing our ABCs as we sing them, or counting speckled frogs. A lot of different songs, totally depends. But I'm always striving to move forward with the assumption that my client is taking in a lot more than they're revealing in that moment. And with autism in particular, I hear from a lot of parents that their child is singing one of our songs upstairs in her bedroom or modifying the words, but using the tune of one of the songs we used in our session. And I just have to say that this feedback is awesome and it's changed my perspective and my approach to our sessions. And although I don't usually set up a schedule of interventions within our session, I do try to provide opportunities for choices within the session, like, do you want to play the piano or sing Old MacDonald next? And I always try to end each song with a clear 5-1 cadence and a the end, so that we all feel that sense of accomplishment and completion and can transition into the next intervention. And finally, I try my very best to end each session with a thank you for music song and incorporate my name and their name into the song so we can acknowledge one another and say goodbye through music. The fifth question, what one session and a group, and which is the best for my child? So a one-to-one session is a great way to focus upon specific strengths and challenges for a client. Now, I love one-to-one sessions because I can really focus on one client and engage in as much spontaneity and deviation from the original plan as necessary according to their response to music in that moment. And groups, most of my groups are with children. So these groups are great for addressing more social goals, and I feel like groups are great for both the kids and the parents with whom I'm working. The parents get to watch their child excel and blossom within the confines of the safe musical container I'm providing, and hopefully walk away with ideas of ways in which they can engage their child musically at home. And the kids get to practice impulse control, sharing, passing instruments to one another, and getting in each other's spaces and playing an instrument solo in front of their peers, all sorts of goals. And although I have very specific goals within a group setting, I certainly want the kids to have fun and feel like they can be themselves and embrace their own challenges and strengths within our circle. My professional recommendation almost always is for kids to have both one-to-one and group music therapy sessions. 6. How much does it cost, and is it covered by insurance? So the cost of a music therapy session varies according to the therapist, but my published prompt pay discount rate is $85 an hour. There are many music therapists throughout the nation who are successfully receiving reimbursement from insurance companies, and it depends on the type of insurance, the diagnosis and codes, and the state. My final answer is that it never hurts to ask and explore different ways in which a family may receive reimbursement for music therapy services. 7. What instrument is best for my child? My answer is almost always whatever instrument your child seems to respond to the most. And as a pianist, I tend to announce my bias and then strongly recommend that you start with the piano as a foundational instrument. But the answer to this question certainly depends upon the goals for your child. Within a music therapy session, we aren't necessarily striving to make beautiful music or teach a particular instrument at all. We're using music as the tool and the motivation to address a different goal. But I do have a lot of clients who come to me for adapted music lessons, and the outcome can be really fantastic. And there's an upcoming podcast that delves more specifically into adapted piano lessons for autism, so I'm not going to say too much more about it right now. But research done in 1995 by Gottfried Schlaug of the Beth Israel Hospital in Boston shows a physical change in the brain structure in people who started music training at an early age. In his publication in the journal Neuropsychologia, reported that a bundle of nerve fibers called the corpus callosum, which carries signals between the two brain hemispheres, is about 12% thicker among keyboard players who started training before the age of 7 when compared to both keyboard players who trained later and non-musicians. Now, this research is awesome, but I just want to say that doesn't mean that just because you are older than 7, you shouldn't start taking music lessons. It's still really great for you. That's just what this particular research showed. It's particularly profound for those who started before the age of 7. Question number 8, what kind of music do you use? So I addressed this a little in our first question about music therapy and patient-specific music, also referred to as client-preferred music. So music therapists don't believe in prescriptive music. Rather, we cater each session to the needs of the client with whom we're working. And not all music therapists have the chance to ask about client preferences, like when a music therapist walks into a patient's room at the hospital and just has to guess according to what is observable in that moment, what kind of songs might be familiar or what kind of songs that patient might like. Fortunately, I usually have the chance to chat with parents or caretakers before seeing a new client, and I get to ask about favorite song preferences. And if I can draw a client into a therapeutic process and captivate their attention with a hook, with one of their favorite songs, oh, that just makes the session so much better. But in the end, it totally depends on the preference of the client with whom we're working. Question number 9, how can I use music at home with my child? There are a lot of ways in which you can use music at home with your child. And moving forward with the knowledge that singing is less noise than speaking, that your child may hear you better through song than through speaking, start thinking about ways in which you can incorporate song into anything, and most definitely challenging aspects of your child's day. And when you do discover songs that your child responds to, learn them together. Learn the words, create motions to go with them, and then once you've learned them, keep the tune and change the words into something more relevant to your child's life. Make up a new version of the song together. And if you have a team with whom you're working, occupational therapists, speech therapists, music therapists, anybody, share that with them, because that can be helpful for anyone to help your child really come out of their shell, to communicate, to connect with others through music. Another intervention I really love is sequencing. And you can find examples of this in some of my YouTube videos. But sequencing, you can do this at home whether or not you have instruments. I usually use different colored drums or a variety of different instruments. And it's sort of like a Simon Says game. So you could put out some pots and different shaped pots that have different sounds, and use I don't know, like a spatula or something that's not too abrasive but makes enough noise so that you can differentiate between the different pots, and just make a pattern. And you make one and then have your child make one, and if it seems too complicated, take it back to only two different ones, the big pot and then the middle pot, and then have them do that. And they end up being so proud of themselves for getting it. And move it up to 3 or 4 in a row and switch it around. And then if that's going really well, you can also try having them facilitate rather than you, so they get to lead and you get to follow. Give it a try. It's really great for the brain and it's really fun for kids. Another way that you can use music, and I think this is instinctual for a lot of families, is to use recorded music to facilitate particular responses. So if you're trying to help calm your child down, put on some of their favorite music. If you're trying to get them to lay down for a nap or go to sleep at night, put on some soothing music and lullabies. You can sing lullabies to them. Have them sing lullabies to you, sing them together. But use music whenever you think it might be appropriate and it might be helpful. Not that you want to have music on 24/7, because you actually need some breaks in that sound. Otherwise, it almost turns into white noise. But use music when you think it might be helpful, and really help your child understand that they can use music as a coping mechanism, and it may prove to be really beneficial in challenging situations. Question number 10. What are the biggest ways in which you've seen music therapy help a child with autism? The most precious moments of my job are those breakthrough moments when a previously nonverbal girl says, "Goodbye, Angie," for the first time. And I get to look up at her parent and acknowledge the awesomeness of what is just the beginning. And music therapy can be really motivating. Making music can be motivating. And sometimes we can get kids to do things that other therapists can't. And when allied health professionals all work together as a collaborative team, the results can be astounding. My favorite successes are helping a child intentionally utter their first words and watching that word turn into a sentence and eventually into an entire song. And like I said, teaching kids and parents how to use music as a coping mechanism, it's awesome. And changing the words of a song to help a child learn the steps involved in brushing their teeth or making it through the day, taking a shower and not forgetting to wash their hair, whatever it may be. Music therapists love this stuff. And so if you're working with a music therapist, bring up those things where you think, we might be able to actually create a song where we sing through all the steps and help your child get through some challenges. One of my favorite things is watching children succeed in a group setting, in my Saturday groups that I have, or performing in a recital that ends with a bow and a pride-filled smile. Those are my favorite music therapy moments. And I could go on, and I'm sure every music therapist has many amazing stories, and maybe I should have a podcast about that soon. So thanks for all your great questions. I look forward to sharing another podcast with you soon. And if you have any questions or stories you want to share, please email me or give me a call. And until next time, keep finding ways to enhance your life with music.